For those of you that are just logging in, make sure you type your name in the chat box for your attendance. Also, check the folder for today. On Schoology, you have a bell ringer question to answer. All right, so today we are going to start talking about medical terminology, why it's important to learn medical terminology, and learn about some different systems of the body and the root words for that. We are scheduled to come back to school on Monday face to face. There has not been any change as of like an hour ago. Got an email from principal, and unless something changes, then we'll be face to face on Monday. So just make sure you're aware of that. If anything changes, I'll probably send a remind message out. And I'm sure somebody will post it somewhere. But as of right now, we are returning back to school face to face on Monday. So with that being said, make sure that if you borrowed a Chromebook from your teacher or a teacher, that you bring it back to turn it in. Okay.
Oh, that's what I was going to ask. I was going to ask, like, do we turn our Chromebooks in tomorrow? Okay.
Monday, yes.
All right.
So Monday is an odd day, so you'll see your first period teacher again on Monday. So they should have the list, that they signed it out to you, because we were supposed to write down a number on the back of the Chromebook. So just bring it back, with the charger so they can do what we need to do. All right. Today we're going to start talking about medical terminology, and you will have an assignment today. So make sure that you complete it today, because I'm putting in grades. It'll be your first grade for this 9 weeks. So just make sure you complete it when I assigned it to you. We won't take the whole time today. I'm going to go through what I need to go through and let y'all work on your assignment. So, all right. So I'm about to share my screen, so I won't be able to see, like, if you type anything in the chat box for the moment. Let's see. All right. So by this point, you know that we are using the AES website for a lot of different things, the notes, and for y'all to take quizzes and stuff on. So when you log in, normally I have out the ones that we're not using to be grayed out, or the ones we haven't gone over yet to be grayed out. I'll probably try to fix that today, just so like when you log in, other stuff don't distract you from where you're supposed to be. All right, so we're going to look at medical terminology. So that's the section that we're on. We're going to look at this first part called roots of word parts. Now, in this lesson, they say word roots. I always say root word because that's what I learned way back a long time ago. So it's the same thing.
What you'll learn.
All right, so our objectives are to explain why it's important for all healthcare workers to know medical terms, name the word parts found in medical terms, and then describe the use of a medical dictionary.
Medical terminology.
So language in the medical field is extensive. It's more extensive than any other languages in other fields. Like other languages, medical language is constantly changing, but it does so at a quicker pace. Rapid advances in science and technology continually add new items. In addition, many medical terms are formed from Greek or Latin words. So that's the reason why these words are long. They look hard. Some of them they don't make sense. Is because they're Greek or Latin words. And we for the most part, majority of everybody's first language is English. So Greek and Latin is kind of foreign to all of us. So it's critical for healthcare workers to have a strong knowledge of medical terms in order to perform their jobs well. One way to gain this knowledge is through the study of word parts. Understanding the parts is the key to learning medical terminology. So you're not going to know every word, every medical term that's out. You're not going to know it. But it's important to understand word parts and to understand suffixes and prefixes, because if you know something pertaining to any of those things, then you should be able to decipher what a word is. Whether you know what the root word means, you know what the suffix means, the prefix means, you can put together a meaning of a word just by breaking it down. So that's what we're going to talk about today.
Word parts.
All right, so
Medical terms are divided into these parts.
Medical terms are divided into the following parts. You have your root word, so that's the basic meaning. You have your prefix, which is at the beginning of the term. And then you have your suffix, which is at the end of the term. So in the term shown on the left in this little pink box here, the root words are the words that are in blue. Your prefixes, which come at the beginning of the word, are in green. And then your suffixes, which come at the end of the word, are in yellow. So they have broken it up. They color-coded it for you to see the root word, suffix, and prefix. So you have subhepatic, intravenous, and electrocardiogram. Which of these word parts contains the basic meaning of a term? That'll be your root word. And then we know that a prefix is placed at the beginning of the term. So that's your prefix.
Medical dictionaries.
All right, so by breaking words into parts, it's often possible to figure out the meaning of a word, even if you have not seen the word before. So it might be, foreign to you, might be the first time you've seen it, but you can probably break down some parts of it in order to get the definition. It's a good idea to check the definition in a medical dictionary to make sure it's correct. Now, all medical terms are built from the common word parts. They may come from a variety of sources. Sometimes word parts are combined in new ways to create new meanings, and sometimes have more than one meaning. For example, based on word parts, lithotomy means a surgical incision to remove a stone. And then this same word also refers to a certain type of examination position for a patient. So some of these words will have like double meanings or, two different meanings. So you just got to be careful of that. A medical dictionary is useful only when you cannot figure out the meaning of a word by breaking it into parts. That's false. Some medical terms may have more than one meaning. That's true.
Lesson summary.
All right, so now we're going to look at root words. So this section is going to have different root words, and it's broken out into the different body systems like respiratory, muscular, skeletal, digestive, reproductive, like that. So if you know the basis for a lot of these words, then you can figure out like what they mean.
What you'll learn.
All right, so our objectives are to define root word, then identify basic word roots for body systems, and then pronounce the root words that are common.
Word roots.
All right, so the root acts as a foundation of a word. In medical terms, it often indicates a body part. So your root word should give you the foundation of the word. So it's going to tell you exactly like the meaning, and it's giving you what body part is affected. So for example, the one they have on here is appendicitis. So looking at that word, you can figure out that it has something to do with your appendix. And then itis means inflammation or infection. So it'll be an infection or inflammation of the appendix. That's what appendicitis is.
Learning word roots.
All right, so throughout the lesson, you will study several sets of word roots and their definitions. A good way to remember this type of information is to write it down. This approach helps you to remember the information better, and it also allows you to review the terms even when you are away from the computer. You may write the terms on a piece of paper, or you may choose to use index cards to create flashcards to help you study. After learning each set of words, you will practice matching them to their definitions through an interactive exercise. So we're going to go through the different parts and go through some of the root words that are associated with those parts or those body systems.
Learn roots.
All right, so the first system we're going to look at is the integumentary system. That has to do with your skin. So some root words are seb for sebaceous oil gland, cutane, dermat or dermis, or derm, that means skin. So if you go to a doctor because of you got eczema or you're breaking out or you got anything that has to do with your skin, you're going to go to a dermatologist. That's a doctor that studies the diseases, disorders of the skin. So that's who you will go to. So that's where they get that word from. Derm is the root word, and then dermatologist is like the specialist, which is the doctor that deals with the skin. All right, so you have hydra is sweat glands, and then peel is for your hair. All right, so I'm just going to match these up. Which some of these are really easy. They're not bad. So you got sebaceous glands, which is seb. You got skin, which is cutane, dermat, and derm. Then you got sweat glands, which is HIDR, and then hair is PIL.
Learn roots. Skeletal system.
All right, so the skeletal system, has to deal with the framework of your body or your bones. So these root words are associated with the skeletal system. You have oste, os, and ost. That means bone. So if you which it usually happens in women, but osteoporosis, that has to deal with the bone, like bone loss. It usually happens with women in around, but that's what it has to deal with. So anything that has oste or any of those root words, we know we're gonna have to you're dealing with the bone. You have chondra for your cartilage. You have arthra for your joints. You have ligament for your ligaments, and then myo for your bone marrow. Let's see. All right, so we got your bones, your cartilage, your joints, your ligaments, and then your bone marrow. And then another word, like for your joints, you have this arthra. I'm sure everybody knows somebody has arthritis. That's where it comes from, itis. So it's the inflammation of your joints. So, you can see people's hands swelling that have arthritis. This because their joints are swollen or inflamed.
Learn roots. Muscular system.
All right, so now you have the muscular system. So you have fascia, which is fascia, myelin, which is muscles, tend, and tendon, which is your tendons, which are your tendons. All right, so this one is pretty easy. My mouse. So you got the fascia, which goes under fascia. You got which goes under muscles. And then you got tend, and then tendon for your tendon.
Learn roots. Nervous and sensory
All right,
system.
so your nervous
Right.
and sensory systems. You have encephal, which is your brain. So you might have heard somebody saying encephalopathy or stuff like that in the hospital. Those people usually have some kind of surgery on their brain if you got encephalopathy. All right, so acoust and OT, those are your ears. So if you think of acoustic, like listening to music, ocul and ophthalm is eyes, neur is nerves, and myo is spinal cord. All right. So you got your brain, your ears, your eyes, your nerves, and then your spinal cord.
Learn roots. Cardiovascular system.
All right, so cardiovascular system.
Right.
Also, sometimes I'll say circulatory system, same thing. Has to deal with the heart and its, structures and its system. All right, so you have artery for your arteries. You have hem and hemat for blood. You have card and cardi for heart. You have phleb and vein for veins. Then you have capil for capillaries. So this is blood. This is veins. This is heart. So there you go. You got your arteries, your blood, your heart, your veins, and then your capillaries.
Learn roots.
All right, so then you have your lymphatic system. So these are structures that have to do with the lymphatic system. You have lymph, which is the same thing, lymph, spleen for spleen, thymus for thymus, and then tonsils for tonsils. So those are your root words for from your lymphatic system. All right.
Learn roots. Respiratory system.
All right, the respiratory system. So these are structures and the root words for these structures that deal with the respiratory system. So you have larynx for your larynx. You have pneum and pneumo or pneum for your lungs. So if somebody has pneumonia, they'll say pneumonia. Nas is nose. Pharynx is your pharynx. Trachea is your trachea. And then sinus is your sinuses. Sinus will show up also in skeletal system. Because it is actually holes in your skull, what your sinuses are. So it also, we'll talk about that in the when we talk about the skeletal system. My mouse is tripping today. All right, so your digestive system, you have esophagus for your esophagus, you have colon for your large intestine, you have hepat for liver, you have oral for mouth, like oral. When you taking oral medication, that means you're taking it by mouth, either taking a pill or you're like swallowing liquid or whatever. Pancreas is pancreas. We've talked about that already. Enter is small intestine, and then gastro is your stomach. So if you have any kind of like gastric problems, they'll talk to you like, with gastro as your because they're dealing with their stomach, and then also other things that are part of the digestive system. Okay. So you got your esophagus, you got your large intestines, your liver, your mouth, your pancreas, your small intestines, and then your stomach.
Learn roots. Urinary system.
All right, you have your urinary system, and these are the organs and stuff that pertain to that system. You have nephron or kidneys, ureters for your ureters, urethra for urethra, and then cyst and vesic for your urinary bladder. Oh, put it in the wrong spot. So there you go.
Learn roots.
All right, so now you got your endocrine system. You got your adrene for your adrenals, your gonad for your gonads, your pancreas for your pancreas, parathyroid. You got pineal, pituitary, thymus, and then thyroid. All right, so let's put these. These are kind of easy because they are exact like the word. A minute. Gonads and parathyroid. Okay. So you got your adrenals, your gonads, your pancreas, your parathyroids, your pineal, pituitary, thymus, and then your thyroid.
Learn roots. Reproductive system.
All right, you have your reproductive system. So, you have a male and a female version of that. So each one will be different. For orchid, test, and testicle is for your testicles that men have. O4, ovary, or for ovaries. Ovaries are found in women. And hyster, metry, and uter are your uterus, and those are found in women as well. So if you've ever heard anybody get a hysterectomy, that means that their uterus, you don't have it, it's gone. That's what a hysterectomy means. So we know that hyster is uterus. Ectomy, that last part of that word, means like a surgical removal of. So that's what all that means. All right, so let's put these together. This one, this one, and this one. So you got, what did I do? Oh, this thing. So you got your testicles, your ovaries, and then you got your uterus. All right, so pneumonia is a condition of which of these organs? So we know that if we look at the word, this first part, which is your root, means lungs. So pneumonia is a condition that affects the lungs. So you might have had pneumonia before. You might know somebody with pneumonia, and that they have trouble breathing because of the pneumonia. Gastrointestinal is related to which body system? We talked about the root word gastr, gastra, having to do with digestion. And renal calculus is a term for which of these conditions? So renal has to do with your kidneys. So it'll be a kidney stone. Osteoporosis is a disease of which of these items? And I gave this example a few minutes ago about osteoporosis. So we know if we look at the root word, they has to do with the bones. That's what oste is. Cystitis is an infection of which of these organs? So that will be your bladder. Subcutaneous refers to a part of this item, skin. So remember, cutaneous or cutane has to do with your skin. And then bone marrow and spinal cord share the same type root, which is myel. So we know that's true.
Lesson summary.
All right. So these last two sections aren't like PowerPoints or aren't slides. They're just kind of for you to study, look over some stuff. So I'll just quickly go over this. So with this is just like studying the word parts. And you can change the mode at the bottom what you want. You can do like flashcards if you want to. You can do spelling if you're trying to figure out how to spell it correctly. You just play the audio and they give you a word and you type it in there. And then you can do the matching game. So you'll just pick, you pick it and they'll disappear once you get them correct. And then you can do a test if you want to do a test. So it's pretty much up to you, like how you want to review. It's like a little built-in review system for that part. And then the review challenge will give you like 20 questions. They're going to they got a test bank of 59 questions. They'll pull 20 questions and let you take it and I guess see how you do and all that stuff. So that's you can use that as a review. So what I'm going to do now, I'm going to open this quiz up, this word parts roots unit quiz. That's what I want you to complete today. That is going to be your grade for today. So I'm going to open that right now. I'm going to put it in the chat box so you'll know what to do. can go straight to the what is this? Oh, wrong spot. Wait. Let's see. No, it's not what I wanted. So I'm gonna put the link to the AS website in the chat box, and then I'll put what you're supposed to be doing, so you'll know where to go. So you'll go to the medical terminology. And under that, you're going to do under the medical terminology module, you'll do the word parts. The word part groups quiz. So that's the first section. So that'll be your first grade for this 9 weeks. I am going to put it in today. So make sure you complete it. Get these attendance. Oh, goodness. Yes, if you're done, I'll put your grade in.
Alright.
You'll
Have a good one. Be safe.
Thank you, you too.